So this is also known as ablation placenta. We have predisposing factors for abruptio placenta. When we say predisposing factors, this means the natural factors that we cannot change. So when we say natural factors, this means the age, the gender, we cannot change those. While precipitating factors are factors in which we have something to we can do about it, like our weight, we can um, gain weight or lose weight. So what are the predisposing factors of abruptio placenta? We have maternal health, hypertension, sudden uterine decompression, advanced maternal age. So hypertension can damage blood vessels in the placenta. Sudden uterine decompression, common after amniocentesis, can cause placenta detachments. And advanced maternal age, also the risk due to declining placental health. So we also have uterine conditions, which we have daghan na o grand multiparity and fibroids. So what are fibroids? Fibroids can distort the uterus, affecting placental attachment. These are kanang masas na ning turok. Grand multiparity is daghan siya na anak. So placental issues, short umbilical cord. A short umbilical cord can tug on the placenta, leading to separation. So behavioral risk, smoking, drug use, previous abruption. A short umbilical cord, mo jud ni ang kanang kuan bitaw, like same sa charger. If the charger is short, then dali ra siya maibot. So this can tug the placenta, leading to separation. We also have behavioral risk, smoking, which contains substance called nicotine, which cause vasoconstriction, drug use, previous abruption. So this vasoconstriction, gamay ra o blood supply, decreases cardiac output. So cardiac output is measured in stroke volume times heart rate. So this cardiac output is how much blood is being pumped by the heart in under a minute. So this is important to know because how well or the normalcy of the cardiac output is equal to if the organs will be supplied with oxygen. So the question, which of the following risk factors for abruptio placenta is associated with weakening of the uterine lining due to multiple pregnancies? Grand multiparity. Classify abruptio placenta types. We have two types, which is concealed and overt. So I did not know that there are two types of abruptio placenta. I thought that it's going to be concealed, but we also have overt. Kasi why I thought it was all concealed, because concealed manggod the reason abruptio placenta primary signs and symptoms is we have dark red na bleeding kasi na-trap internally ang blood. So like it detaches first at the center of the decidua. So yan na trap ang blood. So muna siya concealed kay sa center. And we also have overt, which begins at the edges of the eye. So blood escapes from the uterine cavity. That's why fresh ang blood niya. So abruption involves separation of the center of the placenta first, with internal bleeding contained within the uterus. Overt abruption involves separation sa edges. Overt. Okay. So which type of abruption is characterized by separation of the center? So that is concealed. Ba? So abruptio placenta, Describe the signs and symptoms of abruptio placenta. Abruptio placenta signs and symptoms. The signs and symptoms can vary on the type of severity. F. Separation. So, painful vaginal bleeding, dark red vaginal bleeding is the key symptom of abruptio placenta. Painful vaginal bleeding. Port wine discoloration discharges. Discharges may have a port wine color due to the blood. So abdominal pain can range from mild labor pains to sudden knife-sharp pain. Board-like abdomen. So this is also something na I consider to be unique with abruptio placenta. It's like board-like abdomen. So what is the visualization for that? So the uterus becomes rigid and tender. Rigid and tender. So board like. So we have Cavalier syndrome, and it's in the abruptio placenta board like abdomen. Signs of shock include rapid heartbeat, HR, low blood pressure, and dizziness. Fetal distress, change in fetal heart or movement can indicate fetal distress. A pregnant woman presents a rigid, tender abdomen, rapid heartbeat, and bright red vaginal bleeding. Which symptom pattern is most consistent with overt abruptio placenta? Most consistent? No abdominal tenderness, that's crazy. Minimal external bleeding and mild abdominal pain, moderate vaginal bleeding. Rigid tender abdomen and bright red bleeding. So overt man, so bright red jud siya. You're doing great, girl. Explain the diagnostic methods for abruptio placenta. Diagnosing abruptio placenta typically involves diagnosis based on signs and symptoms like abdominal pain and dark red vaginal bleeding, ultrasound to visualize placental detachment, and clotting studies to assess any coagulation issues. So this is the diagnostic methods we used for abruptio placenta. What do we mean by diagnostic? So this is for us to diagnose, from the word diagnose. So we have clinical diagnosis based on its signs and symptoms, which is katong mga board-like mga tiyan, abdominal pain, bleeding, uterine rigidity. We also have ultrasound para ma-visualize nato siya directly, and clotting factors assesses coagulation factors. So, in diagnosing abruptio placenta, which diagnostic is known for being quick, readily available, clinical diagnosis. To outline the management of abruptio placenta, so we have hospitalization if the fetus is below 36 weeks. So abruptio placenta, third trimester na siya, so we will have a baby na normal. So di pareha sa uban dira, first try and second try, no, dili na mag-viable ang baby. So the management of abruptio aims to stabilize the mother. Delay pregnancy if bleeding is not life-threatening and fetal heart rate is normal. Manage bleeding episodes. Bed rest in side-lying position. Monitor fetal condition. Observe for signs of DIC, disseminated intravascular coagulation. So, deliver cesarean section jud ni siya kasi this is a emergency na situation manggod ang abruptio placenta, and observe vaginal delivery if fetus is dead while bleeding is mild and mother is stable. Okay, so when should a pregnant woman with abruptio placenta be hospitalized according to the guideline? Wala ko kabasaan. When the fetus is below 36 weeks. Yeah, so dito na dito kag hospital 36 weeks below. So discuss postpartum observation after abruptio placenta. After delivery of baby following abruptio placenta, postpartum observation is crucial to detect and manage potential complications. So key focus areas include bleeding, Cavalier uterus. Watch out for penetration of blood into the uterine muscles. So myometrium of the uterine na dira ang blood compared sa colon-sensing ectopic pregnancy, which is sa abdomen ang blood. So, leading to board-like abdomen. So, complications observed for signs of maternal shock and postpartum hemorrhage, rigid tender bruising. Which of the following findings suggests the development of Cavalier syndrome's uterus after delivery from abruptio placenta? Rigid tender abdomen with bruising. Last na ata ni. So, identify potential complications of abruptio placenta. Complications from abruptio placenta can affect both the mother and the fetus. So, we have maternal shock, which is low blood pressure, rapid heart rate due to blood loss, anaphylactoid syndrome, allergic reactions to fetal tissue entering the bloodstream. Fetal complications can be equally severe, so prematurity, fetal hypoxia, fetal death. Early recognition and management of these complications are crucial for both maternal and fetal survival. Sheehan syndrome, pituitary gland damage from blood loss. Sama na. Sheehan syndrome. So, nanatag diri sa mga complications na dili kay ko familiar with. So, maternal shock, low BP, low H, rapid RR due to blood loss, anaphylactoid syndrome, allergic reaction to fetal tissue entering the bloodstream. So, ang fetal tissues, mother siya sa bluff, muna anaphylactoid syndrome, postpartum excessive bleeding after delivery, acute respiratory distress, severe lung injury leading to breathing difficulties, Sheehan syndrome, pituitary gland damage from blood loss, renal tubular necrosis, kidney damage due to low blood flow, DIC, widespread blood clotting and bleeding, early birth due to placental separation, lack of oxygen reaching the fetus, death of the fetus in utero. Following delivery after abruptio placenta, which finding indicates postpartum hemorrhage, and what management steps should be taken? So first na mistake, excessive vaginal bleeding, which finding indicates hemorrhage. Hemorrhage atong ipangutana, treat with uterine massage and oxytocin. And a quick postpartum exhibits low blood pressure and rapid heart rate, but maternal complication is likely occurring. Low blood pressure and rapid heart rate, maternal shock. So, yung difference sa hemorrhage o sa shock. Maternal shock. So, maternal shock is linked the observed vital signs. Low blood pressure plus rapid heart are classic vital signs hallmark for shock from any cause. May cause shock, but it is the source of bleeding, not the name of the shock state itself. Okay, source of the bleeding, manggod siya. Last na ni please. Which maternal complications from abruptio placenta is characterized by low blood pressure and rapid heart rate? Okay, maternal shock.